had that one for 15 years at least.
Just had one? That's it?
No, I've got tons.
Oh, you do? But this is the most prominent.
Yeah.
All right, so you shouldn't feel anything, like I said, nothing bugging you at all. We could just make a little on the top of this. You have a bunch of these, and I'm pretty positive this is a lipoma. I'm sure my girls could diagnose this too here. They would know what this is too. Just gonna kind of try to loosen up around. Again, make sure I'm not hurting you at all. Squeeze it out like this now. I don't know if it's ready or not. Let's see. Gonna just lift up. Can you push in the top, down the top? One more time. Squeezing. Stuck to you. I think I'm just above it, actually. If I get under there, I'll get to it. There it is, I think. Is this your first one you've ever had removed? Or all the ones you have? Oh, there it is. Look at it. There he is. There he is. He's crowning. Ready? I'm gonna squeeze again. Dab again. There you go. There it goes. Pop right out.
All right.
And just had a little fibrous tissue overlying it, and it was getting in our way. Make sure I'm not hurting you, okay? Just because I go underneath and I loosen. There you go. He's got a little mohawk. A little mohawk effect.
Wow. Yeah. Interesting.
It looks like one of those sour patches or something.
Yeah. I was just, you know what I was thinking? I was thinking a cannibal. I wonder if they would think that was like a little delicacy or something. Like a little something you fry up or something.
Good
you
Lord,
know?
You never know.
Isn't that sick? Like, let's squeeze those out first and then fry them up with some butter. Yeah.
When you hear the things that people consider delicacies, you're like, God, it might as well be.
Right? I know. It's sick to say that, but you know, it probably would be, right? Because it's like a little perfect piece of fat or something.
Mm-hmm. That was actually really interesting to see what's the difference in the colors?
I think that I'll cut it open for you to see. I think that yellow on top was probably it, and there was some fibrous tissue underneath that it was just covering it.
Gotcha.
But we'll take a look. We'll see. A lot of times the fat from a lipoma looks a little different than the fat next to it. It's like it's a slightly different color. Like you can tell it's its own little thing. I just want to make sure my stitch was good and it's not gonna. Good. We're going to put a long stitch in there now that will come out in 2 weeks. And you're out of here.
That's great. Whatever the numbing agent is, you can't feel a thing.
Yeah. What would we do, right? If we didn't have that, it'd just be terrible.
I figured just suck it up.
Oh, I don't know if I could do that. I don't know if I would bear. I think people would just be living with this. You'd just be lumpy. Or we just call you lumpy. Okay, grab this sucker. My instrument just to see it. There you go. I'm going to turn you out a little. Just a little awkward. I'm just trying to grab your skin here. What does it want to grab? Doesn't want to grab it. There we go. Oh no, you're good. It's like it's so interesting because I've been using these forceps, these same size ones for my whole career, and then now for some reason I'm coming. Sometimes I go, I wish they were a little smaller. What the heck? Because they're really small ones. They're like delicate ones for facial surgery. So it's like I'm never happy, I suppose. That's what it is. Right? I think it's a female thing, yeah. That was very nice and diplomatic for you to say. My husband would say, oh yeah, that's why. That looks good. Just makes it harder for me to grab the skin, but we got it. So we're gonna wait 2 weeks. You live close by, right? We can take these out.
I don't work too far away.
Oh, okay.
I don't live very close.
Oh, okay. Well, you might be able to take these out yourself too. So I said I had like a little mohawk because I think this is why initially when I tried to pop it, it wasn't coming out because it's just fibrous tissue over it.
Gotcha.
I think maybe if I squeezed it, the whole thing would. It's like a peanut with the casing. That's what you can say. You know, I think it would all kind of squeeze out in here. Look, I can probably squeeze it out. It's just stuck in this little case.
Gotcha.
See, it's all, I can't even really squeeze it out very much, but it's all well encased like that. That's why it's kind of its own little entity, I guess, and it just pops out so easily. But it's the yellow seats under there.
That. Yeah.
If I cut through it, you'll be able to see it. It's just the opening. See what's under there?
Yeah, totally. It's all the same. It's under the
It's just
other
under
tissue.
this little. Okay. Cute.
What makes a lipoma so unique is it that the fat cells don't spread out; they just cluster together.
It's like one fat cell that just decided to divide and just create like a clonal colony of itself. So it's benign, but it's all its own. They're all like twins.
Right.
You know, they're all like the same. Not twins, but they're all identical, I suppose. That's it.